Good news has been hard to come by recently for a government increasingly under fire for its handling of the pandemic. Claiming it has reached its ambitious target of 100,000 tests a day was hailed as a success story. But this morning, the Transport Secretary seemed to acknowledge that had mass testing been in place sooner, many lives could have been saved.
If we had had 100,000 test capacity before this thing started, and the knowledge that we now have retrospectively, I'm sure many things could be different.
Mr. Shapps also alluded to the next phase of government plans to roll out an extensive track and trace programme with a phone app to be trialled on the Isle of Wight next week. The app, which will be voluntary, will track when people have come into contact with someone who tests positive for the virus. The government hopes its plans will not only allow for a reopening of the economy, but also to ease pressure on an overburdened NHS.
We've just lost one of our nurses that work at the hospital. Just a bit emotional.
It does feel very, very worrying and very surreal right now at the moment. Hoping that I can cope with the pressures of ICU.
Real testimonies of the constant mental pressure felt by those on the front lines. Beyond the very real physical harm they are exposed to on a daily basis, there are increasing worries about the mental toll exacted on the NHS.
Normally, intensive care units see about 20% death. In COVID, we're seeing about up to 50% death. Alongside this, we are having to work in areas we're not used to. We're using facilities that aren't designed for intensive care. And we've got many staff who aren't used to intensive care and who never really wanted to do that kind of job in the first place, who have voluntarily come in, and they are deeply psychologically disturbed by what we're seeing.
The British Medical Association has found that 1 in 4 doctors reported worsening mental distress during the pandemic, and nearly half of the doctors had to source their own PPE or relied on donations.
I can't sleep anymore, and all I can hear is like the alarms at work. Constantly in my head, constantly hear the phones ringing, the ventilators going off.
Meanwhile, in an interview with The Sun, Boris Johnson has admitted that a contingency plan was put in place in the event of his death as he battled coronavirus last month. He told the newspaper he was not in particularly brilliant shape and had to be given litres and litres of oxygen. It was a tough old moment, he said. I won't deny it. They had a strategy to deal with a death of Stalin type scenario. All eyes now on Mr. Johnson's strategy and his plans to ease the lockdown as he hopes to take the country on a path to recovery.
The road out of lockdown, it's all anyone wants to know. When can we go back to normal? Or more realistically, the new normal. When and how to open schools, how to get people back to work, and importantly, how to get them there without overwhelming public transport. It is also unknown and so fraught with difficulties, as Kemi Zoran reports.
When the country does come out of lockdown, what to do about public transport? Buses, trains and trams are the country's other COVID front line.
I'm very, very worried about my safety because my colleagues are dying, so I'm worried.
At the last count, more than 30 transport workers had lost their lives to COVID. The official advice is to get on buses or trains for essential travel only and stay 2 meters away from other passengers.
When businesses and schools do start to reopen, how are we going to get to work? When in many parts of the country, public transport, under normal circumstances at least, is so often stretched to breaking point.
Normally, on an average working day before the crisis began, we would be expecting to carry around 100,000 people on the Tyne and Wear Metro into and out of the centres of Newcastle, Gateshead and Sunderland. That would be based on, in the rush hour, around 400 people travelling on each train. Because of the social distancing guidelines, keeping a 2-metre gap between people who are travelling, that now has reduced significantly to around 64 people per train. So you can see there's quite a profound impact on the number of people we can carry throughout the day, reducing from around 100,000 people to about 30,000 people.
How are you feeling about getting on things like buses and trains if you do need to get back to work?
Well, that's why I've got the mask, my friend. Yeah, obviously, I think we're all a bit sceptical, aren't we?
Hopefully people will respect distance on trains and tubes. I don't know, let's see.
We're just waiting for word as to what will happen. And I think that's making people more wary of what's going to happen. And I think sometimes that, it's worked, but are people too afraid to go back to work?
Public confidence in getting Britain back to work is crucial.
Yeah, we remain unconvinced that it's safe to return to work on the basis that the government seems to be planning a big step up in transport services and transport usage. We want to see a graduated return when it's safe on the basis of proven risk assessment and proven work instructions for our members. If we don't get that, we will have to instruct our members not to take part in those activities. And if they believe that they're being put in serious and imminent danger, we will tell them to walk off the job. The government has to convince us, and it has to convince our members, and it has to convince the public.
For families with children currently doing their lessons round the kitchen table, it's even more complex. Lifting lockdown will, in many ways, be just as challenging as the start.
Well, the government has been repeating its mantra that any exit from lockdown will be guided by science, but the former chief scientific advisor, Sir David King, has now put together an independent committee of academics and experts to work out how best to navigate the long and complicated road ahead and provide what he calls robust, unbiased advice. And he joins us now. Sir David, what does your committee have that the official sage one doesn't?
Well, I think the most important thing we have is independence, as you were just saying. Nobody on this committee will be from government. When I was chief scientific advisor, all of my advisory committees had no more than 2 people from government, myself as chief scientific advisor, and in this instance, it would have been the chief medical officer. And in that way, you can assure yourselves and the public that the advice is scientific advice and it's not being influenced by government. If you have a committee of sages with 13 members from government appointments, and the total is 23, you can see the concern that I have. But the second, I think, and more important concern is that when I was chief scientific advisor, we were recovering from the sea crisis, and the Phillips Commission report into that crisis and how the government had operated focused in particular on whether or not the science advice was independent. And that report concluded that it was not, because the science advisors were not able to go out to the public domain and tell people what the science advice was. And what Phillips said was, chief scientific advisors of each government department have to be independent of government and have to be able to put their advice to the Prime Minister and the Cabinet and also into the public domain.
So will you be drawing together, an overall message from your committee for the public? And, could we see a scenario in which your committee is saying one thing and the government is saying another?
Yes, and that certainly could happen when I was chief scientific advisor as well, because the science advice is just that, it's advice. And then strategic and political decisions have to be made, and the politicians make those decisions. There was no conflict with me in them making those decisions, and I think I was very clear about that.
Do you think they're doing the wrong thing at the moment? Is there anything they should be doing right now that they're not?
If you invite the chief scientific advisor onto your program instead of me, would he be likely to accept? Can he accept? Can he tell you what his science advice has been? When I rejoined government in the Foreign Office to handle the climate change negotiations leading up to Paris, I was no longer allowed to go on television and radio, even though when the Foreign Secretary invited me in and congratulated me, he said, "You are a talking head. You can go out and boast to the public about what we are doing on climate change." But I wasn't allowed to. So there's a kind of command and control atmosphere, which means that the science advisory system doesn't gain the trust of the public, and I doubt that it also gains the trust of the Prime Minister and the Cabinet.
There's been some confusion today around the whole question of over 70s because of a story in the Sunday Times, which the health secretary then said was wrong. Now, you're obviously in this demographic. What is your understanding of whether you should be, effectively confined to quarters or not?
I think my position on that is very simple. I do fully understand that the older you are, the more likely you are to die from this epidemic. But at the same time, I do also consider that one 75-year-old is different from another 75-year-old in terms of fitness and capacity to work, etc. So I think what I would suggest is that the government should hand this over to the GP who knows the patient, who knows the person. Now, my GP would be able to tell you that I suffer from asthma, and asthma is a precondition that puts you at risk. So I suspect that my GP would advise me to stay as I am in the house because I need to be protected. But I think this is the only source of real advice could come from your GP who knows what you're.
Thank you very much indeed. Thanks for joining us.